Greetings everyone, I am Elham Younesi and I'm going to present my research article Music Therapy Awareness, which was done for the applications and careers in psychology at Oklahoma City University. I'm gonna start over again. Greetings everyone, I am Elham Younesi and I'm going to present my research article Music Therapy Awareness, which is a review article which was done for a class project for my applications and careers in psychology class at Oklahoma City University. So just an overview of what I'm gonna go through for my research paper is an introduction and then method section and results and discussion and limitations and references. So starting with introduction, music is a type of art that almost everyone is familiar with and exists within every community and society. Starting from ancient Egyptians who used music as healing incantation to the development of empirical researches regarding influence of music on physiological, psychological, and emotional conflicts in 90s and 20s indicates the importance of music and its role in therapeutic settings. Many researches have been done to provide evidence and examine the effectiveness of music in therapeutic setting and reduction of the depression, stress, and anxiety symptoms. A few Taiwanese undergraduates at Aishu University showed significantly positive changes in terms of stress and anxiety reduction and relaxation when they received music therapy intervention. Music therapy had more clinically significant positive effect on the reduction of depression symptoms on patients with low and medium level of depression in comparison with those who only received psychotherapy. Music therapy and listening music strategies and techniques helped adults with minor and major depressive disorder to reduce their depression, anxiety, and distress symptoms. One of the studies provided an evidence regarding the effectiveness of classical and Baroque music on reduction of stress and depression symptoms on the patients who were diagnosed with low and medium level of depression. Music in general had significant positive impact on the reduction of stress, and classical music had clinically significant positive effect on reduction of the heart rate after being exposed to stressor than silence or any other types of music. Whereas in another study done to measure the reduction of stress and anxiety level of participants who were exposed to stressors, group of researchers discovered that those who listened to their preferred music instead of the typical classical music used in music therapy interventions while being exposed to stressors showed more positive result in the reduction of stress and anxiety. So what I'm going to go through for my research is that I thought education plays an important role in shaping the perception of humans on music, music therapy, and psychotherapy. The level of the knowledge about treatment methods and therapies could indicate the level of acceptance of the certain treatment method used for reduction of stress, anxiety, and depression. Many studies show the significant positive impact of some types of music on reduction of stress and enhancing moods, whereas some people who approach music when they feel stressed might have different taste in the style of the music that they approach when they as in anti-stressor outside of the clinical settings. So starting with the method, participants were 62 young adults, 29 women, and 32 men, and one did not report. And ages were ranged from 18 to 29, from OCU community, Oklahoma City University in Oklahoma City, Oklahoma. And all the participants were randomly selected, and there was no preference in gender, race, or age. Therefore, participants were asked to indicate their age and gender. Participants were asked to fill out a brief survey which was designed by the author. Approximate time was about 10 minutes per survey, and the data collection was done in the span of 2 weeks. 29 questions, including the questions about age and gender, were asked, and then there was 3 types of questions in the survey in total, rating yes, no, and open-answered questions. In the first 21 questions, the participants were asked to rate the level of their knowledge about music therapy, music, psychotherapy, and psychology. The ratio scales were from 1 to 7. 1 means strongly agree, 4 was neutral, and 7 means strongly agree. Students were asked to indicate the rate of the frequency of stress, anxiety, and depressive moods that they experience often, and how much they accept music therapy and psychotherapy as a form of treatment for psychological disorders, and how much they think humans should approach the music when they feel anxious, stressed, and depressed. Another question was to rate the music that they often approach when they feel stressed, anxious, or depressed. In the yes-no questions, participants were asked to indicate if they had any knowledge about music theory and if they hadn't received any psychotherapy in the past. In the open-ended questions, participants were asked to indicate if they had any musical experience, how many years they had experience in playing any musical instrument, singing, and play or sing in a professional setting. As a result, we found out that when we compared participants' view on effectiveness of music therapy and psychotherapy, we did not find any significant difference, and participants perceived both music therapy and psychotherapy to be an effective treatment method for depression, stress, and anxiety. The data showed that genre of the music matters when feeling stressed and anxious, and it is less likely to listen to nothing when feeling anxious. As shown in the figure 1, classical, jazz, rock, pop, and folk music are the genres that participants mostly listen to while feeling anxious and stressed in comparison with other genres. According to the results, the participants indicated that they had less knowledge about music therapy and psychotherapy. We asked the participants about their experience regarding music and knowledge about psychotherapy. However, participants' perceived knowledge about music therapy and psychotherapy was not associated with their perception on effectiveness of music therapy and psychotherapy as shown in Table 1. For the discussion, we saw that the results show a significantly difference for the style of the music that people approach when they feel stressed, anxious, and depressed. It is more likely for the people to approach classical music when they feel depressed than other types of the music. In most of music therapy sessions, music therapists tend to use classical music in their intervention, which our results show that people are more likely to approach classical music even if they are not receiving therapeutic interventions. According to the results, not only in therapeutic settings but in general, people are approaching music to reduce their anxiety and stress and enhance their mood. The results indicate that knowledge about music and psychotherapy is not related to the acceptance of music therapy and psychotherapy as a form of therapy in order to reduce depression symptoms. As indicated in the previous researches, music is a form of arts that for years Starting from Egyptians to the recent centuries, people approach it to enhance their mood and use it to reduce their stress. Some of the limitations that we faced was that a major one was that the short amount of time for conducting the research and the limited number of questions for exploration. However, the main concerns and ideas of the research that we wanted to explore, such as relation between knowledge about psychotherapy and music therapy and acceptance rate of them as therapeutic forms, were measured and covered in the study. Music therapy is developing every day, and there are many healthcare centers that provide music therapy for patients who are suffering from psychological distortions. For further research, we recommend the researchers to ask more detailed questions that are specifically addressing certain composers and more details about the style of the music. Information about the major of the participants and questions that are seeking for more details about their knowledge of music and psychology could be helpful in order to explore a significant relation between education and perception of the society regarding music therapy and psychotherapy. And here are the references that were used for the research. Thank you everyone for your interest and attention.